Assam Health Minister Hemanta Biswa Sarma relentlessly focused on testing and quarantine. The omnipresent role of the Assam Health Minister has helped the state prevent community spread despite over 2 lakh returning from other states following the coronavirus-induced lockdown. He spent his morning at Guwahati Medical College Hospital checking the COVID wards. At noon, he is in Jorhat Medical College Hospital, 300 km east of Guwahati, taking stock of ventilators. By evening, he can be seen giving instruction to health workers at a quarantine center in Golpara, over 400 km west of Jorhat. This superhuman race against coronavirus was facilitated by a chartered flight. People in several villages of Assam are offering puja to keep Hemanta Biswa Sarma safe from the coronavirus. There has been praise from everywhere. Even his worst critic admitted that he has been doing an exemplary job as a health minister in keeping the pandemic under control in the state. Under his leadership, Assam is doing the highest number of tests among 8 northeast states. He has built a robust quarantine structure and a strict system of surveillance. At another time, when some doctors in an hospital were reluctant to go inside corona ward, Hemanta Biswa Sarma led from the front, went near the patients wearing protective gear and said, "I also have a family and I have to live for them, but I cannot let these people also die." As health minister for 13 years, he had built 4 new additional medical colleges in the state despite criticism. Now it's coming into good use, he added. He said, "I'm not worried. I knew a large number of those who are coming from outside would be infected. That's why we are ruthlessly enforcing the quarantine. It's helping us to avoid community transmissions. Besides, we have kept the medical facility for any sudden spike." He is not a leader who just passes instruction, but he is a man of his word who gets involved day and night in fighting this war. On April 15, Assam became the first state in the country to procure PPE kit from China, even when the total cases was just 32. The bombshell dropped on March 30th when the Assam government realized that over 700 people from Assam had participated in the Tablighi Jamaat congregation in Delhi. While the police network swung into action to detect and bring them to a quarantine center and the effort going wary, finding it hard to trace, Hemanta Biswa decided to play the game of persuasion. He ramped up quarantine center, provided high-quality nutritious food, and publicized on TV and social media. The living conditions inside quarantine center of those Jamatis who had been detected early were broadcast live to send out the larger message that they were treated well and not being persecuted for attending Tablighi Jamaat event. "I am the state health minister. I have to save every life. This is not a time for politics," he said. These words wound the heart of many Jamatis who are in hiding, and they came forward to surrender or their relatives and villagers disclosed their whereabouts. And when the Jamatis recovered, Hemanta Biswa Sarma reached the hospital to give a personal send-off with bouquet and gift. A ritual he has continued with 164 Jamatis recovered patients till now. The idea was to ensure that they don't face any social stigma or boycott when they return home. Hemanta Biswa Sarma is working day and night. It's remarkable. If such people become health minister everywhere instead of 1 year, we will overcome this crisis in 3 months, said Azma, the chief of All India United Democratic Front. His visibility and hands-on approach is reassuring for the citizens. Irrespective of how many gets infected, it's important to make people feel that their leader is there for them and is giving 100% to bail them out of this crisis. At these trying times of crisis, we need more health ministers like Hemanta Biswa Sarma in the northeast states and all over India.